Because this is Endometriosis Awareness Month, I thought today's topic would be endometriosis. So first of all, let's just talk about what endometriosis is. So let me show you this picture. I know you've seen this picture. I use it for everything, so there's no question. So the lining of the uterus, the inside of the uterus, is called endometrium. When you see that tissue in places other than inside the uterus, it's called endometriosis. And typically that tissue undergoes the same hormonal changes as your normal lining does, so that when you bleed, for example, that tissue can bleed as well. And if it's sitting on the ovary, it can form an ovarian cyst, which is typically echogenic, meaning it's got junk in it, usually old blood, and it's just a blind pocket of old blood, but that's what an endometriotic cyst is. It can look like powder burns, like somebody put a cigarette out on the tissue. It can look like little vesicles. It can look like little blebs. There are many different looks, and because the bleeding occurs, there can also be scar tissue or adhesions that form. So when you look at endometriosis as a disease, it's a very all-encompassing disease because it can be associated with pain. It can be associated with infertility. It can be, a very all-inclusive disease.